the I Mold You So podcast with Katie Buckland Weiss.
All right. Hello, everybody, and welcome to this week's episode of I Mold You So with Katie Buckland Weiss. I'm very excited as I have Dr. Oseni, my treating physician, back with us this week, diving into all things mold illness and chronic inflammatory response syndrome. Thank you so much, Dr. Oseni, for joining. I'm so excited to have you back on the podcast.
You're welcome. You're welcome. Thanks to be back. I'm really excited about this session. You've been a trailblazer, so we're very proud about everything you're doing, bringing awareness to this condition. We need more and more people like you to keep spreading this news. So we're excited.
Thanks. Well, I'm just glad to be able to inform people and also provide them with a resource and a physician that they can go to. And we've had lots of questions, lots of conversation coming out of that initial podcast 2 months ago. So I do, from our followers and from our listeners, I have a host of questions that I can't wait to dive into today with you. But just want to introduce you again to folks that might be listening in for the first time. Dr. Oseni is a board certified doctor in internal medicine, pulmonary care, critical care, and sleep. And he specializes in treating mold illness in CIRS using most often the Shoemaker protocol, which is what I'm on. So that being said, quick background for everybody. I met Dr. Oseni about 14 months ago now. It was August of 2024, and I was so sick. And I landed in his office because just 2 weeks before that, after being in the ER with atypical pneumonia and then wanting to do a fungal test, and I denied that, we ultimately did a urine test through my husband and found out I had really high level of mycotoxins. And then my husband referred me to another physician who said, this could be mold illness. Let's get you to a specialist. And lo and behold, I ended up in your office in Weatherford, Texas.
Yes.
Where you did a host of blood labs on me, and looking at symptoms ultimately confirmed that I had CIRS. And then you encouraged me to check my house, a new build, which we did check my house. And then we found mold throughout, which I think it's important to mention. We were not in an old house. We were in a new build that had a water leak. And I was living in that environment for about 3 years total, and 2 years probably getting sick, having those levels go up, being exposed, and then I hit the threshold. I just passed the threshold, and that's when all my symptoms just came flaring. And I was sick for close to a year before getting help through you and detoxing and all the things that we'll get into today. So that being said, Dr. Oseni, that's my story. And as I've been sharing it, more and more people are coming out of the woodwork, or I'm getting comments that are like, this sounds so familiar, or preach, sister, or hey, did you have this symptom or that symptom? I also think there's a number of people that are out there that are sick and going through what I went through before I figured out it was mold illness, going to this doctor and that doctor, be it urology or neurology and sports medicine. I mean, all these different doctors that I went to because I had all of these different symptoms. So what is the typical profile of a patient, and what is their story when they land in your chair, in your office? What led them to you in most cases?
Wow. So thank you for having me back once again. I'm excited about sharing the message about chronic inflammatory response syndrome. Just like you said, from your own journey, it's a constellation of symptoms that adds up. Just to kind of sidetrack a little bit, I got into mold treatment 5 years ago because I was seeing a slew of patients, lots of patients that have multiple symptoms that I just couldn't unravel, especially after COVID. And we're going to be talking about the impact of COVID on this as well. So a lot of patients that come to me, just like you, I've seen so many doctors. They've had symptoms for a minimum of at least 1 year, with brain fog, headaches, loss of focus, anxiety, a lot of GI symptoms, pain. They've been diagnosed with chronic pain syndrome, chronic fatigue syndrome, fibromyalgia, memory loss, some of them even dementia. So a lot of times it's like they're looking for answers. I think 90% of my patients have been to probably 10 to 15 doctors before coming to me. And
Yes.
they're not getting answers. They're not getting better. That's when they eventually do more research and end up coming to me. And I'm hoping with this podcast, we can continue to shed some more light about how people can recognize this condition and seek help sooner than later.
Right. And one of the things that I think worth mentioning, given our listener pool, is the mold might not even be visible. But if you have these symptoms, then
Yes.
maybe you need to
Yes.
start thinking about mold. Because in my case, the mold really was not visible. It just wasn't. It wasn't. My walls were not covered with black spots everywhere. And I have seen since starting this, people have been sending me pictures and they have mold all over their walls. Well, that's an easy conclusion to
Right.
come to. For me, and I think for so many people, it's really looking at the symptoms and the cluster of symptoms and the length that they've been
Yes.
sick and going to all these doctors and not getting better. Right. And maybe
That's
even in
right.
my case, I was on different prescriptions and the prescriptions were honestly making me worse. And
Mm,
they were trying to treat nerve damage or this or that. And I'm like, this is only making me worse, folks, because we weren't treating
that's
the root
true.
cause.
That's true. That's true. And part of the problem is because they don't teach us this in medical school.
Mm-hmm.
So most doctors don't know about the impact of mycotoxin and how to treat it. I didn't know. I mean, I'm a board certified internist, intensivist, pulmonologist, and sleep specialist. I didn't know about mold until 5 years ago. And I started learning about it. And that's how I ended up getting in touch with Dr. Shoemaker. And he's the one that pretty much taught me and mentored me and opened my eyes to the impact of mycotoxin and chronic inflammatory response syndrome and what it does to the body. But without going through that pathway, you will know. So a lot of these patients, they go to their doctors, they go to their specialists, they really are not thinking about mycotoxin and they're just diagnosing, different things, POTS, fibromyalgia, chronic pain without getting to the underlying problem.
Just because they don't know. It wasn't on
They
the
don't know.
checklist in medical school.
Yes.
Just hearing the term mycotoxin gives me PTSD because it's just so nasty in my own experience and it just wreaked havoc on my body. Can you dive in a little bit to what these mycotoxins are really doing and to what systems?
Absolutely. So mycotoxin, that's the toxin from a mold. Okay. Just like we said, we all get exposed to molds at different intensities. Unfortunately, 50 to 70% of our buildings have water damage at some point in the time. So we have a lot of mold in our buildings, our homes, our office spaces, schools, libraries. So when we get exposed to mold and it releases the mycotoxin, normally our antibodies, we build antibodies to get rid of the mold. 25% of the population, including you, just have a genetic abnormality that you're just not able to create antibodies to get rid of the mold and the mycotoxin. So the mycotoxin sits in the body, stuck in the innate immune system, and it's wreaking chronic inflammation. The chronic inflammation leads to release of multiple different cytokines. And the cytokines continue to do other dysregulations. It's causing immune dysregulation. It's like having chronic inflammation on steroids. And those inflammatory process leads to a lot of damages, a lot of oxidative stress, a lot of neuronal brain injury, nerve injury, a lot of GI symptoms. Name it, it's been linked chronic pain, muscle pain, frequent urination because of what the dysregulation does to the hormones. So it's like a cascade of events, one leading to another event because of the direct toxicity from the mycotoxin on all these different cells and systems. So that's why it's called a multi-system and multi-symptom illness, because it's doing damages to different parts of the body.
Yes, which I experience, which a lot of our listeners are also experiencing. And just for the lay people, if you have mold in your home or your office or whatever building in your car, let's say, the mycotoxins, you're breathing those in from the mold because the mold is putting those mycotoxins off. Is that right?
That's right.
Okay. So as I piece this together and I'm taking notes, this is just so fascinating in the best and the worst ways, if you will. So you're talking about the cascade. So you have the mycotoxins and the cytochromes. So if you remove yourself from the environment, because we talk about that is key into recovery, with, let's say, the binder and detoxing. So you get the mycotoxins out. Then if we look at these cytochromes, how do we, am I saying that right?
Cytokines. So those are the substances that get released because of the inflammation.
Okay.
So it's called cytokines, yeah.
So will the cytokines level reduce once the mycotoxins are out? So together those kind of calm.
Right.
Okay. All right. Just trying to understand that. It's not like a vitamin you can take to restore the cytokines. This is all systematic. Okay. Wonderful. And thank you for touching on some of the symptoms as well, because there's, what is it, about 18 or 19, and you have to have how many to really get the diagnosis?
So they're like minimum of 37 symptoms.
37.
They bunch into cluster symptoms.
Okay.
Okay. So you kind of have 13 cluster symptoms, and you need to have 6 to 8 out of those 13 cluster symptoms. So brain, lungs, muscle, GI, nerves, immune system, sleep. So all those have each cluster symptoms, psychiatric, depression, anxiety, frequent urination, just excessive sweating.
Postnasal drip. Let's talk about that. Okay.
Yes.
Because I had asked you prior to the recording, talking about folks that have this constant clearing of the throat. Now, I didn't have it, but my husband did, and he also suffered from CIRS. And a lot of listeners have mentioned that. And you had shared with me that that's really a result of the postnasal drip. Can you talk to me a little bit about the role of postnasal drip in CIRS?
So, yes. So, with mold has couple of different impacts on the respiratory tract. So number one, the mold by itself affects the clearance. Okay, the ciliary, we got little cells and the mold affects it. So mold by itself causes increased nasal sinus symptoms with congestion and drainage. So that's one. Number two, because of the reduction in the immune system, immune dysregulation. So there's going to be a recurrence of sinus infections. Okay, that's number two. Number three, very common to have marcons.
Okay. Spell that for us.
It's marcons, MARCONS, multiple antibiotic resistant coagulase negative staph.
Yes.
Okay, so it's like a colonization in the nasal passage by this bug. It's causing some local symptoms in the nasal passage, but what it does also is to release its own toxins. Okay,
the marcons is releasing another toxin. Okay,
it releases its own toxins that just makes all the symptoms even much worse.
Okay, and for me, marcons has been very difficult to treat, and I have been diligent in it. And there's a number of different ways. Different practitioners can encourage you to treat it one way or the other. I've been doing the EDTA and the silver, and I've done it, taken breaks, and then I swab, and still trying to really tackle that. And I think that might be causing a little, allowing me to flare more frequent than if I had really killed the marcons. But I'm still getting after it, because like you said, there's mold everywhere and we will have exposures. And this is something that I will have to manage for the rest of my life, right?
Because you have the genetic abnormality that you're just not able to get rid of the mycotoxin yourself. Yeah.
Right. And so through supportive therapies like cycling on and off the binder and continue detoxing and sweating, but I'm living a normal life now. I'm not bedridden and next to a space heater on my floor crying with anxiety and blurred vision. Okay, so once the patients are there, and I think it's important to talk about this, Dr. Oseni, there's this idea and reality that mold illness can be very expensive, whether it's
Yes.
remediating your home, moving, the treat. And it is important to me to share with our listeners my authentic self and my authentic experience. It was very expensive for my family from a number of different avenues. I was out of work, so I was on long-term disability, so I was not getting a paycheck. I also work largely on commissions. I was not earning commissions. So that was expensive for us because I was so sick. Then I was going from doctor to doctor. I had copays, I had deductibles to meet, and then we had additional testing that was not covered by insurance. And then I was just trying everything under the sun. Oh, let me do this supplement. Let me do that supplement. And
Right.
we spent tens of thousands of dollars. It was a huge financial impact. And then
Wow.
once we put the pieces together and remediated our home, it can be very expensive.
Yes,
But
it
there
can.
are people out there that do not have the luxury or the paycheck that I personally had that allowed
Mhm.
me to be so proactive about this once we put the pieces
Right.
together. All that being said, are there some recommendations that do not have a hefty price tag that you might recommend to folks that think they are or know they are suffering from mold illness?
Absolutely. So yes, just to kind of piggyback on what you said, it's very unfortunate that it's such a very, very money consuming. It basically consumes all your funds when you're trying to deal with mold and mycotoxin and getting better. So, and and the reason why I'm so happy you're doing this is to just spread the news so that people can start early. The
Right.
early you start, the easier and faster you can get better without having years and years of damages from the mycotoxin. So just like we said, the first thing is to have a highest index of suspicion. Instead of waiting for 20, 15, 25 years of being ill, if you've been ill for like 6 months, 1 year, and you've seen 2, 3 doctors and your symptoms are just being like a mystery, and you need to start thinking about this be mold related. So the sooner the better. Okay, that's one. Number two, we spoke about the VCS, the visual contrast sensitivity test, which is
Yes.
an online test, which is not expensive. I think it's
$15,
just about
$20.
$20. It's a test that's been available for probably 70, 80 years now. It was pioneered by the military to screen for biotoxin in related exposures. You do it online, you get the results right away within 10 minutes.
And that's because
That cannot
mycotoxins affect your optic nerve, right?
it
And then you can
affects
kind of
your
measure that in the
your
VCS test. Is
effects.
that right?
Basically, yes. So the VCS test is basically, you know, visual contrast sensitivity test. So when the blood vessels at the back of the optic nerve, because of the mycotoxins, it causes vasoconstriction, and we lose the ability to differentiate different contrasts. So it's a good screening test, and
Okay.
it's not expensive.
Right.
So if that shows that, and you're able to test your home and see more, that's where it gets challenging in terms of remediation, because remediation is expensive. I have so many patients very, very sick, and they're just not able to fully remediate their home, and they just cannot get out of their home. I have patients living in tents outside their house
Yeah. I mean, I spent
because
nights in the tent when we
in
put it
tents.
together. Yeah.
So yes, it could be overwhelming. It could be quite expensive, but there are certain things that we can do to, number one, kind of have that high index of suspicion, kind of get through that sooner so that the treatment won't be as prolonged compared to somebody that's been sick with the mycotoxins for decades and decades.
Right. And what is the cost of that to your health? That's ultimately because I truly believe if I had stayed in that environment, not remediated, I was deteriorating so much I couldn't tell my left from my right?
Right.
Wow. Okay. And then through all of this, you have really communicated the importance of removing yourself from the environment. And I want people to hear that is really going to be um, a huge player, game changer
It
in
is.
recovery. Would you agree or disagree if you move out of the environment, the moldy environment, that over
Right.
time you could heal just by simply moving out of the environment?
Yes, absolutely. Might depend on the genetic makeup, depend on how much damage is to the body, injury to the body. Okay. And I think we're going to be talking about the NeuroQuant MRI and no. So there are quite a number of people, they got better by just moving out of the environment. And that's why step one of the protocol is avoiding further exposures to mold or any other biotoxin.
I mean, look, I walk around with my moisture meter. I'm crazy town. I don't want to play around with
That's
this.
good. That's good. So yes, you can get
And this is
better
an
by
affordable
just moving out
option.
of
This
it.
is like $30,
Right.
$40. You can test your walls and stuff. It's not, and I know that there's like home ERMI test that might be, $30 to $50 and air quality test. And then if you have an expert come in, it can, be $750 up towards $1,500.
That's true.
So you can kind of piece this together. Okay. So a couple other questions that I'm just going to fire at you. Okay.
All right, bring it on.
Do you have to have a virus in order for like mold illness or CIRS to activate, to come online?
Good question. So what we've seen and what Dr. Schumacher has done a lot of research on is that the lot of viral infections that we call triggers, they're called primers. Okay, they dysregulate the immune system and then lowers the threshold for the mycotoxin-induced chronic inflammatory response syndrome to manifest. And COVID is a good example of that. That's why
Okay.
since COVID, we're having a big pandemic of mold-induced chronic inflammatory response syndrome. So the COVID was able to dysregulate our immune system, lower our threshold, even though we've been living in the same environment with the mold, the mycotoxin is in our body, but because our threshold is lowered, it kind of triggers the manifestation of the mycotoxin-induced chronic inflammation. So
you
yes,
have seen an uptick. It's like
uptick.
that perfect storm. And we could
Right.
have been living in the moldy environment, never had COVID, and we'd be just fine. But because there was COVID and the moldy environment, the impact it had on our immune system, you were seeing, and I imagine the medical world is seeing an uptick in CIRS.
So it doesn't have to be viruses only. Okay, it could be Lyme. It
Okay.
could be
Yes.
other infections. But yes, in a lot of people, there's always a priming event that brings out the mycotoxin induced chronic inflammation. Yes.
Okay, so I'm going to do a little sidebar here because during all of this for me, I was in a chronic state of fight or flight because my
Yes.
husband had been sick for, 2.5 years before this from the mold, but we
You're
didn't
right.
know any better. And his symptoms were very different as a male than mine and all the things. But part of this, which I think is important to discuss outside of the blood work and then the symptoms that you see, is the nervous system.
Yes.
And I even find now that when I'm in a high stress situation that some of my symptoms might flare. And I wonder if that's because my body's like programmed this way. And Dr. Oseni, it is hard as heck to calm a nervous system.
Yes.
But do you see that these kind of go hand in hand? CIRS, mold, and then a nervous system that is just on fire?
Big time. And that's what the VCS test and the NeuroQuant MRI kind of supports. There's ongoing neuroinflammation, inflammation in the brain, various parts of the body, various part of the brain, and different parts of the brain, the ones that affects our emotions, the one that affects, sympathetic system. That's why the mood swing, anxiety, stress, flatten, and then
Irritability.
big time. And
Yeah.
then that's POTS is due to the autonomic, nervous system dysregulation from the mycotoxin. POTS
So
meaning
wild.
postural orthostatic tachycardia, where your blood pressure is just dropping and your heart rate is just going haywire. So yeah, there's huge. As a matter of fact, the brain is the main target for the mycotoxin.
Yeah. And let's talk about that. We'll get into the NeuroQuant because I found it absolutely fascinating. But you mentioned the heart rate up, the blood pressure down. That is something that my family experienced, and I would experience it in the middle of the night. I'd wake up in the middle of the night with my heart rate just through the roof. And they're like, it's anxiety. And I'm like, this is something more, y'all. This is something more. And then my blood pressure has always been low, but it was real low. And then my husband also found that to be true to the point where he was fainting, from low blood pressure. So it just is crazy. All right. So we talked a little bit about the virus and the uptick you've seen since COVID, but other things like Lyme that could impact this.
Right.
We talked a little bit about the 25% of the population that has the genetic makeup. And
Yes.
some of my listeners are like, well, what if I don't have the genes? Could I still get sick from mold? Can you address that for us?
Yes, you can still. Actually, 5% of people that have CIRS, chronic inflammatory response syndrome, do not have any identifiable, HLA genetic abnormality. So yes, you can be sick without having any genetic abnormality, especially if you get exposed to a significant amount of you don't have to have a genetic abnormality to have the chronic inflammatory.
Yeah, the mold's going to win regardless of genetics. Okay, so we're jumping the gun on HLA, but because you brought it up, I want to talk about it. So when a patient comes to see you, you review the symptoms, and then you also do some blood work.
Yes, please.
To confirm, is it genetic only that you're looking at, or that blood work tells us what and where does HLA fall into this? Tell us what HLA is and the association it has with mold illness, please.
So yes, so part of the blood work that we do is the HLA in addition to the cytokines. These are not regular CBC, ESL that we do in the conventional realm. This is completely different because we're testing that innate immune system that the mycotoxin attaches to, and it causes a chronic, activation of the innate immune system. So the HLA that's an antigen that's on our chromosome 6. It's important for what we call antigen presentation. And I'm going to explain that.
Okay.
So when we get exposed to mold, our initial part of our immune system is called the innate immune system. Recognizes the antigen, the biotoxin, the mold, and it recognizes it, and it now presents it to the adaptive immune system. It's like a transfer mechanism.
Okay.
But when there's a genetic abnormality, the HLA, and there's problem with antigen presentation, then you're not able to transfer the bound mycotoxin to the innate immune system. You're not able to transfer it to the adaptive immune system to make antibodies.
So that's why it's just hanging out in you.
It's just hanging out in that initial part.
Okay.
And it's because there's a genetic abnormality. And when it's stuck in that part, then you're just chronically activating that innate immune system. So it's like inflammation on steroids.
And there's not like a supplement or vitamin we can take to support that HLA?
No, we're born with it.
I just had to ask, I'm the problem solver looking for that instant gratification and quick fix, which we know is not the case when you're healing from mold illness. Okay, so thank you for describing that about the HLA and a little bit about how the genetics play into this. So one of the other things that keep coming up is oxidative stress. Wow. Talk to me about how this plays into mold illness. The mycotoxin causes it. What does that really mean?
Okay, so we all go through oxidative stress. There's a lot of cellular mechanisms in our body is making free radicals, okay? As we're digesting and processing our protein and carbohydrates, we're releasing free radicals and everything. So those are normal processes, okay? But fortunately, we have antioxidants that helps to bind to those free radicals. Mm-hmm. And we're able to neutralize the effects of the free radicals that are being made. So any situation that causes increased release of free radicals, infections, stress, mold, increases our free radical, and we don't have enough antioxidants to take care of it. And that leads to what we call oxidative stress. So oxidative stress is one of the conditions in mold that we know just adds to the slew of the symptoms, because when we're in oxidative stress, it's causing additional problems. It's causing problems with our mitochondria. We're not making enough ATP and we get tired. We're not able to handle our immune system. Oxidative stress affects our brain. It affects our cardiovascular system. So it's just one thing leads to another thing. So that's true. In mold-induced chronic inflammation, there is oxidative stress because there's chronic inflammation. So we're releasing a lot of free radicals.
I can't keep up.
We can't keep up with.
So what are some things we can do outside of removing ourselves from the environment and detoxing to kind of support oxidative stress? I mean, as a layperson, I'm like, eat more blueberries, but talk to me a little bit real talk.
Yes, you just mentioned one of it. So it's all hands on deck when you're talking about oxidative stress. You want to increase our antioxidants by lifestyle changes. Number one, reducing our stress level. Number two, getting adequate sleep. 7 to 8 hours of good quality sleep improves antioxidant production, reducing infection, avoiding exposures, taking certain diets, blueberries, leafy greens, polyphenols, and also glutathione. Glutathione helps.
Okay, so glutathione. So that is something I pop into your office regularly for a big shot of that. I also do the hydrogen.
Hydrogen molecule, yes.
Yes, and I feel so clear after I do that. It's just fantastic. It's like being at the beach all day, right? But the glutathione, so one of the things you cautioned me about, which I really appreciate, is because I'm like, oh, I can take glutathione at home. And you said, hey, we just want to be mindful that you're getting the right formulation and the right dosage. So if I'm not able to come into your office, or there's a clinic in Fort Worth that I'll pop into, once a week to get a shot of glutathione, which right, it helps detox in a big way. Is there something you can recommend for folks that are at home? Is there a brand that you like, a form that you like? Or maybe you can share that with me after the podcast and I can share with my followers, because that is an ask that they get. And I'm like, well, I, go see my doctor and get my glutathione shot. But if there's a form that they could take at home or something you could recommend, I think that would be helpful to folks.
Yeah, it's called a liposomal glutathione. So the different manufacturers that have it's because it's difficult to absorb glutathione. That's why the best form is IV or injections. But there's a liposomal form of glutathione where when you take it by pill, it's more bioavailable, and at least it would raise the level, but there is no substitute for we make glutathione in our body, but when we're going through chronic inflammation where it's depleted, your body needs it not just for detox, but it's much needed for your mitochondrial function. And the mitochondrial is the powerhouse of our cells. That's where we make ATP. That's when the glucose that we take in is converted to ATP. ATP is the energy source. So you can imagine if we don't have enough glutathione, where not only were we struggling with our detox, but it leads to mitochondrial dysfunction. And we're just fatigued and tired and weak.
You bring up, or I brought up glutathione talking about this, and this is probably for another podcast, but I am curious. Tylenol has been a really hot topic the last few weeks. And one of the things that I read is that Tylenol depletes glutathione. And I'm putting you on the spot here. But when I think back to my own onset of this, again, I was in fight or flight. I was having chronic headaches, but my migraine medicine was very debilitating as well. So I just kept taking Tylenol. Tylenol. I was taking Tylenol,
Really?
had a big old red bottle of it. And I can't help but think, did that regular dosage of Tylenol impact my glutathione, which made my case even worse because of the continued mold exposure? So that's something I want to pick your brain about a little bit later, maybe, is Tylenol, the impact that it could have on glutathione. Can we get glutathione at your office in pill form?
Yes, you can.
Okay, great. I'll share that with folks after the fact. Okay, do you look at, and I guess the Shoemaker protocol, look at antibodies like IgE and IgG? I know some protocols do. Does the Shoemaker protocol look at those antibodies?
It depends on what concepts, we're looking at different, for instance, this condition SIRS triggers autoimmune, so there's some IgG antibodies to glial antibodies that we check in to see if somebody is having autoimmune GI symptoms. So, but the IgE concept is conventional IgE getting elevated when we get exposed to, if somebody has allergy to mold. Okay. So that's kind of a little different.
Yes.
From,
And I think it is important to mention that you can have an allergy to mold and then you can have mold illness. Completely different, and you can have
completely
both, right?
different.
Yeah.
You can have both, yes. You can
Yes.
have mold allergy, you can have mold sensitivity, and you can have mold-induced chronic inflammatory response syndrome.
Yeah. Okay. There's lots to dig in here. Okay, we talked a little bit about the throat clearing, the urination frequency. So I want to talk a little bit in a little bit more detail around the frequency to run to the potty, because I was peeing, being very just upfront here, up to 60 times a day. And, they were having me do pelvic floor exercises. I was diagnosed with interstitial cystitis. But the more and more I share my story, the more and more this is a very common symptom. And in my own research, and also in the testing that you did, y'all looked at my MSH, which was very low. And I'm curious, is it the low MSH that makes you have to urinate all the time? Do I have that wrong? What is this that's making you pee all the time? Because from a lay person's perspective, I'm like, oh, my body's trying to get rid of the toxin, so I have to pee all the time. Do I have this right? Do I have it wrong? Share with us.
Close. So basically the MSH, the melanocyte stimulating hormone, is a very potent peptide in the body, okay, that regulates a lot of things, including hormones. So when it's very low, it's affecting the ability to, release ADH, antidiuretic hormone.
Okay.
So that's what prevents us from peeing. So when the ADH is low, we're just peeing all the time, okay, and we're intravascularly depleted. That's why our osmolality is high, we're thirsty, and we're just peeing. So the MSH, so it's kind of like a step approach in terms of what causes what. So the chronic inflammatory response syndrome from mycotoxin causes our MSH to be very low. And when our MSH is very low, that leads to low ADH, which is the antidiuretic hormone. And that we lose the ability to, we're able to keep us from urinating, and we're just urinating all the time. And
Okay.
so that's how it is.
Again, the mycotoxins mess those levels up.
Yes.
Okay, but I want to be mindful of time here, but I have so much to talk about. Maybe we talk about detoxing children in another episode.
Okay.
I know you have a podcast out now, so I'll make sure that I am directing people to that, because you just did one on mold as well. So maybe you cover that there. I haven't had a chance to listen to it. So at the top of the podcast, we talked about mentioning the NeuroQuant and potentially the GENIE blood test. So as I went on my journey with you, I was detoxing and making progress, and I wanted to track my progress, but also understand the damage and the impact that this mold had potentially done to me. So kind of the next level in my process with you was to do the NeuroQuant. And if we have time, I want to talk a little bit about my findings and also the GENIE blood test. Now, for our
Right.
listeners, this is not preliminary screening that you do to determine if you have mold illness. There's lots you can do before that. But this is, I was in the process. I was eager to know more and how I could further supplement my recovery in a just well-rounded, all hands on deck way. So we did the NeuroQuant and the GENIE test. Can you talk to me a little bit about those tests, what it reveals, and the correlation it has to mold illness?
Sure, absolutely. So GENIE stands for gene, information, and expression. Okay. So just kind of go back to the basics. Okay. Every cellular function in our body is being coordinated by gene. Okay. We should think about genes as like our microchips in our computer.
Okay.
So genes are like coordinating every function in our body. They send a message and they're regulating what happens during inflammation, during clotting, during hormones. Gene is what's regulating every function in our body. So Dr. Shoemaker and his team were able to do research into what's going on in CIRS patients, what genes are being expressed and what genes are being suppressed in their body, because it's all about genetic expression.
And this is through the blood. You're able to see this through the blood. Wow. Okay.
It's like it just shows us the roadmap of what's going on in our body at that particular time. So the GENIE is a test that just helps us to reflect on a constellation of genes to help us know what's going on, what stage, and are we in what we call a molecular hypometabolism. It will let us know the cytokines are being regulated by genes. So the genes that's regulating those cytokines would be overexpressed, in that GENIE, we're able to tell it actually hones down in terms of what type of exposures, because the genes that get overexpressed in mold is different from in Lyme, is different from in endotoxins. So the
so you
GENIE
can have
report,
people that it shows Lyme is not an issue for you, but this is.
Exactly, yes.
And if I even think back to my GENIE test with you, I was, again, so fascinated by the findings, because one of the things we just wanted to make sure that there wasn't, any whispers of was Parkinson's. And in that GENIE test, you were able to say, hey, these are not overexpressed. That is some good news. But on the flip side, which I didn't even really put this together until you shared this with me, but like PTSD was overexpressed.
Overexpressed, yes.
And that's really eye-opening for me, and I look back and I'm like, okay, well, that helps explain the constant fight or flight and everything.
Absolutely.
Yeah,
It's
pretty
just
remarkable.
having a roadmap of what's going on in your body at that particular time by trying to measure your gene expression. And it's been an excellent tool. It's expensive, but it breaks it down into stage 1 prior to treatment, stage 2 while on treatment, stage 3 while you're on VIP treatment, stage 4 after VIP treatment, and then stage 5, people that have a relapse have certain genetic what it looks like. Yes.
Well, I'll be curious because I'm going to start VIP in the next month or two. I've kicked the can just a little bit for other reasons, but I'll likely do another GENIE test. I think one thing that might be helpful to get my results, I don't know if I have them. I know we went through them, but we shared them with some of the listeners because there were some great findings there. Now, the other thing I want to touch on is the NeuroQuant, which is an MRI, but there's an overlay, right? So talk to us about the NeuroQuant, because my findings were a little bit scary, honestly. I'm fine. I'm back at work. I'm living and everything, but it was interesting. So talk to us a little bit about the NeuroQuant.
So NeuroQuant brain MRI, it's a volumetric MRI of the brain, basically measuring the volume of different parts of the brain. Okay, so what we've seen with CIRS, chronic inflammatory response syndrome from biotoxin, is that there's ongoing neuronal inflammation, injury to the brain, inflammation, and that causes multiple areas to shrink, atrophy, and that can eventually lead to neurodegenerative disease like Alzheimer's, dementia, Parkinson's, and name it. So doing that brain MRI shows the areas of the brain that being affected, and actually the pattern you see for mold is different from the pattern you see for actinals, and it's different from the pattern you see for Lyme. So it's such a powerful, yes, it's such a powerful tool to kind of be able to see it. And then the good news is that after treatment, if one is able to repeat that NeuroQuant MRI, you see the improvement.
Right.
So that's the good news.
So there's hope. There's hope,
it's
right?
reversible. So far, we catch it early before permanent, irreversible brain damage. So that's the news. And we hope by doing this podcast, and I really applaud you once again, we can spread the news and people can, because there's such an increase in
Right.
dementia. And a lot of the recent studies have shown that the dementia is environmental. It's due to environmental exposure.
Okay, so we were talking about the NeuroQuant, and something I wanted to mention there is maybe even being able to share some of the findings of my NeuroQuant with our followers, just for those that are ready to take that step. And I imagine some of the patients that listen to the podcast that are now seeing you might also want to do that. So I think it's, part of the process and very informative. And the good news is that if you catch this early and recover, you can keep some things from happening if you get ahead of it, sounds like. Okay. 2 more questions. As someone works through the Shoemaker protocol, the last part of this is the VIP treatment. It is my understanding that VIP is a peptide of some sort. Do I have that right? Okay.
Yes, please.
Talk to me about VIP.
So VIP is what we call a vasoactive intestinal peptide. It's a very powerful peptide that works on the brain, works on the lungs, works on different parts of the body, and it's been shown to reverse the changes that we see on the NeuroQuant brain MRI. Okay, so that's one. Number 2, it actually helped as a protocol for, and we might even be talking about that with you, people that cannot clear their markers. There's a low dose VIP protocol to help clear their markers because it's a neuroinflammatory, it regulates inflammation, it regulates immune system, and it regulates the brain cells. It's helping it regenerate.
I love that. Regenerate. Yeah. I love that.
Yes.
Well, I'm excited to get started on that VIP and share kind of the experience that I have. And then one last question that I'm getting from a lot of folks, a lot of listeners, of course, are female, although I do have some folks that are men that this has hit them very hard, very hard. But for women, do you see any association with one's cycle that causes a flare? Because I'm getting questions about that. I too have experienced that some of my symptoms kind of pop up throughout my cycle. Anything you can say to that?
Absolutely. So, when we're going through our cycle, that's a high oxidative stress state. So you can imagine if you have chronic inflammatory response syndrome, which is also adding to the high oxidative stress states, is like a combination of, and so symptoms are going to get worse because we're making antioxidants, but we can't keep up with that. We're making free radicals from our cycles and then from the chronic inflammation from mold. So the symptoms are going to get worse, definitely during, and not to talk about the changes in the hormones during the cycle.
Yeah, that play into it.
Also makes the symptoms from CIRS worse.
Okay.
Yes.
So maybe during that time, level up your antioxidants, perhaps.
You might need to increase your antioxidants during the cycle. Yes.
Wonderful. Okay. So last thing I want to give you the floor on, your clinic is providing some wonderful therapies outside of treating mold and CIRS patients. There's a number of things happening in your clinic. Like I mentioned, I pop in for glutathione. I do the hydrogen.
Right.
What other therapies are you offering for? Well, let me take a step back. You do telemedicine. I think that's important for our listeners. You do telemedicine.
Yes.
So people can get their labs done. I think it's important to mention that in many cases, if you have insurance does cover the bulk of the labs that you offer.
Yes.
That was my experience. But you can do telehealth medicine with you if you think you're suffering from mold. Dr. Oseni's information is all over my website. I tag him in my post. He can be found at Alpha Care Wellness. We'll continue to share your information.
Yes.
But what other therapies can people seek and get treatment on at your clinic?
So, we're a full-scale functional medicine practice. So apart from my pulmonary and sleep practice, we do functional medicine. And part of this condition, chronic inflammatory response syndrome, which hopefully we get to talk to about at another time, it causes sexual hormonal dysregulation. Your estrogen, your progesterone, your testosterone. So in our practice, we do hormone rebalancing.
Wonderful.
So we do trying to optimize your sex hormones, your estrogen, your progesterone, because you're not going to feel better if you don't correct those. So we do both male and female hormonal, replacement therapy. And we're very big on longevity. We released a book on longevity, health longevity. So everything that's going to increase your longevity and health span, we're into that. And we know that environmental exposures, mycotoxin is one of the conditions that reduces our longevity.
Yes.
Yes. So that's why we're so big on that and every other thing. So we take care of a lot of chronic GI symptoms, functional medicine way. Now, the SIBOs and the leaky gut. And so we do a variety of functional medicine therapy.
And it looks like you're looking at the whole patient, right? You're looking at the whole patient
whole
and all the
patient.
things playing into it. It's remarkable. And I love it that you guys are so close to me now that I can pop in and do some of those treatments. And then also curious about the hormone treatment and where that falls into, my mold recovery. I'm also 44. So, you probably have some perimenopause going on in there too. So, Dr. Oseni, thank you again for joining me. And I do hope that we can do this again. I bet that you're doing a podcast as well. And your second episode was focused on mold. So I think it's worth promoting that. We look forward to reconnecting with you and sharing more and sending you patients. The goal is to raise awareness for folks that are suffering from this and also physicians. So when they have patients come in and they're sick, it could at least be an ask. It could be a checkbox, do you think this could be mold exposure? Something along those lines. Because by golly, if that had happened to me, I would have been healed quicker, faster, with a smaller price tag, if you will. So thank you again for your time and your expertise.
You're welcome.
And we look forward to continuing this conversation in the weeks and months to come.
You're welcome. Excited about it. Keep up the great job.
Thank you.
You're welcome.
The I Mold You So podcast with Katie Buckland Weiss.